You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I am a genetic counselor, mom of four, and a beagle, and a teratogen information specialist. So what I do is I talk to people about exposures during pregnancy and breastfeeding, before pregnancy, and in cases of adoption. This is going to be another part of our series on workplace exposures during pregnancy and breastfeeding, and we're really excited to wrap this up with our two previous guests, Dr. Jennita Reefhuis, who is branch chief for the Birth Defects Monitoring and Research Branch at the CDC, and Dr. Carissa Rocheleau, who has worked as a reproductive and occupational epidemiologist at the National Institute for Occupational Safety and Health for 12 years. And some of the things we're going to touch on today include military exposures and noise. So thinking about some situations that we in the general public may not encounter daily, but that other people do in certain lines of work. So thinking about people who work at concert venues, for example, when someone is frequently exposed to loud noises, are there increased chances of problems during pregnancy?
That is a great question. So loud noise, especially frequent exposure to loud noise, can cause stress to a person, and not just, in a psychological sense, but there are physiological changes in response to stress. So we know that workers exposed to loud noise are at higher risk of hypertension, for example. That those stress-induced changes to a pregnant woman's body could affect her developing baby, although we're still trying to learn about that. We do know a lot about how sound travels through human tissues, though. And although sound would be muffled in the womb, very loud noises may still be able to damage an unborn baby's hearing. And a fetus's ears are mostly developed by about 20 weeks.
So what kind of precautions or safety equipment would be recommended for people who are frequently exposed to loud noises?
So first, wear hearing protection like earplugs if you're exposed to loud noise above 85 decibels or more. At this noise level, you'd have to raise your voice to be heard by somebody who's standing right next to you. And then secondly, many experts recommend that pregnant women avoid being in a place where the noise is louder than 115 decibels. This is roughly as loud as operating a chainsaw. And so this recommendation is based on the level of noise that's anticipated to be able to reach the baby's ears in the womb and could potentially damage their hearing. So NIOSH does have a free noise level app called the Sound Level Meter to measure the noise around you using your smartphone's microphone.
So there's an app for that.
There is.
Very cool. That is very, very cool. Another place where you can certainly be exposed to loud noises is a gun range. And I think about, how they wear protective equipment over their ears. And then that actually leads to a question that we had from someone who was working as a cleaner at a gun range. And her question was about lead exposure. And piggybacking on that, of course, people in the military are around and may use firing ranges during pregnancy and during breastfeeding. Again, thinking about that lead exposure, are there recommendations about the use, the cleaning, and the safe handling of firearms and bullets during pregnancy and while breastfeeding?
Yeah, specifically around lead, there is very little data on maternal lead exposure during pregnancy and birth defects. We do know that lead can pass from a mother to her developing baby. So elevated levels of lead in the blood during pregnancy can increase the risk for miscarriage and stillbirth, cause the baby to be born too early or too small, or hurt the baby's brain, kidneys, or nervous system. So really, lead is something to stay away from when possible. So wear the proper personal protective equipment, such as goggles, gloves, boots, and protective clothing to prevent contact while working around lead, and use an effective lead removal product to clean your hands. If you're pregnant and think you may have been exposed to lead, talk to your healthcare provider about getting a blood lead test.
And the same goes for breastfeeding. There are some guidelines for managing lead exposure in pregnant and breastfeeding women based on both the mom's and the baby's blood lead levels. And also, I'd add that lead dust can settle on your skin, on your hair, on your clothes, on your shoes, and you can carry that into your home where you would continue exposing both yourself and everyone else in your household. We call this take-home exposures, and there are a lot of things that a person can do to limit that. And remember, this is important for every person in the household, not just the pregnant person. So, and also since we've been talking about noise, I'd like to note that the noise on a firing range has been measured at peaks of up to 160 decibels. We mentioned that many experts recommend pregnant people are not exposed to more than 115 decibels because at that level it could damage fetal hearing. Mm-hmm. So, that's well above that threshold.
So thinking about that as well, not just, the lead part of it, but also that noise factor. What about pilots and aircraft mechanics? So are there any concerns about being exposed to something like jet fuel while pregnant or breastfeeding?
Yeah, this is a common question I've gotten. Jet fuel, aviation gasoline, diesel fuel, and the exhaust that remains when these fuels are consumed, when they combust, contain a number of compounds that have been linked to adverse reproductive outcomes. Although it's a little hard to generalize because these are all very complex mixtures, mm-hmm. often over 100 ingredients.
Wow.
So at extremely high exposure levels that have been used in animal studies or in human cases associated with huffing, which is intentional abuse or inhalation of gasoline or jet fuel for the purpose of getting high, we have seen some adverse reproductive and developmental effects on a fetus. But at the smaller doses a person would normally encounter in the workplace, the evidence isn't clear. I do think it's wise to reduce exposure as much as is reasonably possible. So by wearing protective clothing or changing clothes as soon as possible if you get some on you, washing your hands frequently, and trying to improve ventilation as much as possible in your workplace.
What about people who are exposed through microelectronics? So things like soldering, polishing, and welding, either through a job or through a hobby. Is there anything that they should consider while pregnant or breastfeeding?
Yeah, there definitely are potential harmful exposures that are connected to manufacturing or creating and metalworking, such as exposure to oil mist. Metalworking fluids, which are one of the most common sources of oil mist exposures, are used to make, for instance, the cutting of metal possible. They prevent rust, they lubricate and cool electronic parts. So they're pretty widely present in those kinds of jobs. So there is some research from our National Birth Defects Prevention Study that found that mothers who were exposed to oil mist may be at risk for having a baby with a heart defect. Oil mist, again, can be carried home on your skin, hair, clothes, and shoes, like Carissa was mentioning earlier. And if you can't avoid these exposures, it's a good idea to wear protective clothing. Wash contaminants off and change your clothing and shoes before going inside your house.
And with home-based work or hobbies, I think it's really important to think through how you will keep contaminants from that studio in your home from getting into the rest of the home. So, oftentimes with home-based businesses or hobbies, we're doing this in the basement, in the garage, in a spare bedroom, and that space shares ventilation with the rest of your home. So it's really important to think about, is there anything I'm using that could be a hazard? And how do I contain that and keep it from getting throughout my home? And on the topic of solder, I would say solder containing lead should be avoided during pregnancy and breastfeeding for any of those home-based businesses, because it's just really hard to keep leaded from the home.
Got it. And that, again, absolutely makes sense. I find sometimes we think about that single person exposure. So I'm so glad that you mentioned that, especially when you're doing it in your home or in some part of your home, like the garage, you have to think about how it's going to affect the rest of, your living space. Such an excellent point.
Yeah, and some of those things like lead, they stick around.
Yeah.
So it's not just when you're pregnant and breastfeeding, but you're going to have a toddler who's crawling around on the floor and putting everything in their mouth. So, we really want to make sure that the home is a safe place.
Absolutely. Okay. Toll booth workers, truck drivers, and non-plane mechanics. I know we already talked about aviation mechanics, but automobile and truck mechanics, for example, they can be exposed to a lot of exhaust. What are the concerns, if any, about being exposed to exhaust during pregnancy and while breastfeeding?
Yeah, that's a good question, too. And it's kind of what Carissa was also just saying. That's another one of those components, exposures that consists of tons of different chemicals and components. But one of the ones that I'll pull out and talk about for a little bit is a class of chemicals called polycyclic aromatic hydrocarbons, or PAHs. They're produced, they come into existence when coal or oil or gas, wood, garbage, or tobacco are burned, and breathing air contaminated with, for instance, motor vehicle exhaust, cigarette smoke, wood smoke, or the fumes from asphalt roads or frying hamburgers are common ways one could be exposed to PAHs. The thing is, we don't know exactly what levels of PAH exposure people might have in each of these specific jobs, right? So that's something that there's more research needed. But based on data from CDC's National Birth Defects Prevention Study, researchers have found that jobs that by experts were considered to be likely to be exposed to PAHs before or during early pregnancy were linked with birth defects. But again, like I said, there's not been a lot of research, and it's complicated to assess exposures to these kinds of chemicals, and we definitely need some more information.
Yeah, and both fine and ultrafine particulates that are found in exhaust have also been linked to preterm birth and some other issues. So there's definitely cause for concern, but more research is needed.
So what are some general recommendations for people who are frequently exposed to exhaust?
If you're pregnant or trying to get pregnant, talk to your employer to see if it's possible to increase ventilation in your workplace. Like Carissa said, that's always a great place to start. Or avoid exposure to byproducts of burning, a variety of things on a temporary basis before and during pregnancy.
Yeah, and even, there are a number of technologies that can be used, and some of them are very simple and small and inexpensive. So even an in-room air purifier with a HEPA filter can substantially reduce PAHs and particulates in a person's workplace. Exhaust particles will also settle onto your body. So again, you want to prevent that take-home exposure by washing your hands and your forearms when you leave work, changing your clothes right away when you get home, taking off your shoes before you come into the house. And even, some people, we talk about like the toll booth worker, might not have easy access to a sink. Even if you can just wipe down your hands with a wet wipe, that might help get some of those particulates and the PAHs off your skin. A colleague of mine that does work with firefighters found that cleaning the soot off their skin as soon as possible after fighting a fire greatly reduced the amount of PAHs that made it into their bloodstream.
Also, there are steps you can take outside of the workplace. If you're concerned about your health, or if you and your partner are pregnant or trying to become pregnant, you should really talk to your doctor and kind of tell them what kind of work you do, what kind of hazards you are aware of in your workplace, and anything specific that you are worried about or have questions about. Because not all doctors or healthcare professionals always have that in the forefront of their heads to remember about, to ask about jobs. So ask your healthcare provider if there is any part of your job that you should be avoiding during pregnancy or while you're breastfeeding.
Yeah, and if your physician isn't sure, there are so many resources that can help. MotherToBaby is a great example. There are also pediatric environmental health specialty units across the U.S. that a person can contact free of charge to get advice. CDC also has an information line. It's called CDC Info that can connect people to information and resources. And then on the CDC and NIOSH topic pages, we do have a number of pages and resources and links for information on occupational exposure during pregnancy.
And we appreciate you sharing those resources with our listeners. Like you said, there is a lot of information out there. And I really do appreciate the point that, let your healthcare provider know. They may ask or they may not, but if you can keep them in the loop, that can go a little bit further, especially if you need something down the road. Dr. Reefhuis and Dr. Rocheleau, again, thank you so much for being here today. Before we go, I was wondering if there was anything that the two of you would like to leave our listeners with.
Well, thank you so much for asking. First, I really try and emphasize, especially when I'm working with the employers, that protecting pregnant and breastfeeding people from hazards in the workplace protects all workers. I don't know of a single reproductive hazard that is perfectly safe for non-pregnant people. And then secondly, it's also important to note that the majority of pregnant people whose jobs involve some of the exposures we've talked about still have healthy births. So while reducing exposure as much as we reasonably can is important, there are also some benefits of employment like income and health insurance that are something we always have to consider. Finally, that even for people who are exposed to various hazards or contaminants in their workplace, the benefits of breastfeeding usually outweigh the risks of a contaminant in their breast milk. So again, while it's worth looking at how to reduce your exposure, usually continuing to breastfeed is best.
I absolutely agree with what Carissa just said. I do want to emphasize that with every pregnancy, a couple starts out with a 3% chance of having a baby with a birth defect, regardless of any underlying health conditions, lifestyle factors, or occupational exposures they may have. And although you may work around a potential hazard, it does not mean that you are exposed at levels that will cause a problem. Also, I want you to rest assured that CDC will continue to study environmental, genetic, and behavioral risk factors that may cause or contribute to specific birth defects through the work on the National Birth Defects Prevention Study and its replacement, the Birth Defect Study to evaluate pregnancy exposures. Also, if you have specific concerns regarding your work site, you or your employer can contact an industrial hygienist to have your work site evaluated for ways to keep all workers there as safe as possible. And remember, most women can continue to safely work throughout pregnancy, but if you have questions, discuss them with your healthcare provider or call MotherToBaby.
Well, thank you. And again, so happy that we were able to do this series. We get so many different types of questions. And I think what we covered is hopefully going to be very helpful to a lot of our audience and hopefully some new listeners as well. And that's all for this episode of the MotherToBaby podcast. So happy to finish out this series with so much great information. Really happy that we were able to have these wonderful experts on our show. Make sure that you stay tuned for future episodes where we will talk about other exposures during pregnancy and breastfeeding. And actually, listeners, we need you. We would love to have somebody call in and ask a question for one of our experts. Or if you have a topic that you just need to know about, if there's comments or questions that you have for us, we would love to hear from you. So feel free to contact us. So there's lots of ways to contact MotherToBaby. You can call us at 866-626-6847. You can text us at 855-999-3525. You can email us at contactus@mothertobaby.org. And you can also visit our website. So mothertobaby.org is our website where you can find so much information. So links to our podcasts. You can find our chat feature if you want to chat with an expert there. We also have fact sheets, baby blogs, and information pages. So free, no cost to you, no obligation information in a lot of different ways. So please feel free to contact us if there's something that we can help you with, or if you have a great idea and want to be on our show. And MotherToBaby is all over social media. So you can find us on Facebook, Twitter, Instagram. If you're there, we are probably there. So don't hesitate to reach out, like, follow, and retweet. Don't forget, MotherToBaby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.